Hello and welcome to SCN Corporate Connect. I'm Jane King at the NASDAQ market site in Times Square. And with me today, Dr. Ralph Zipper, the CEO of Biofuse Medical Technologies. Really interesting company. Give me the elevator pitch and then we'll go dig a little deeper into what you're doing.
It's interesting, but it's more than interesting. It's game-changing, it's paradigm-shifting technology. Earlier today, we talked about the snail's pace at which medicine moves. I'm a physician. I still practice a couple days a week. I've been bringing medical devices to market for a long time. I've personally trained over 1,000 surgeons. And one thing that neither they have seen nor I have seen is anything that really has changed in medicine. A robot in our operating room is not really change for the patients. Biofusion is a massive change in the world of medicine. It is paradigm-shifting technology. We are replacing sutures and staples with energy, enhancing the body's own natural healing capabilities, uniting two sides of a wound more quickly and in a stronger way than suture could ever do or staples could ever do.
Okay, so tell me how you do that.
I could tell you, but you know what I'd have to do.
I know it's patented, top secret, but you could give me kind of an overview.
This is a very special proprietary energy algorithm that focuses at the point of when tissue becomes most liquid. So we drive energy through tissue without creating any damage. We capture the point at which the tissue becomes most liquid, when the collagen molecules are starting to relax. And then we take that data point and plug it into the proprietary energy algorithm. And over 3 phases, we allow the more liquefied sides of the wound to come together, fusing in natural, mature collagen molecules, which provides immediate strength, so that patients don't have to be careful for months while they're healing, but can get back to work more quickly, get back to the things they enjoy.
So this technology is called Biofusion, which is really a good description for exactly what it does. So bio and fusion, and you're bringing it together, and you're working particularly with women's health. So tell me about that.
Sure. Our entrance into the market will be in the women's health market, and a small portion, but a very important portion of that market, about a $500 million portion of the market, called pelvic organ prolapse. And these are hernias that women develop after childbearing. So more than half of the world's women will undergo a natural childbirth. More than half of them will develop different types of hernias of the pelvic organs. That's more than 1 billion women worldwide that suffer from hernias. And right now, there's no treatment. Pelvic organ prolapse mesh, vaginal mesh, had 30% of that market, but it's dangerous and complicated.
Huge lawsuits and
it's gone. And so now, our contemporaries, women who need surgery now, what do they have available to them? The same surgery that our great-great-grandmothers, old-fashioned suture-based surgery with high failure rates, high anatomic failure rates. We are going to fill that void with a natural and better solution.
Now, tell me about where you are in the process with all the clinical trials and FDA, and when will this be on the market and a woman can actually benefit from it?
Almost immediately.
Okay.
And here's why. We're already 510(k) cleared and CE marked for fusing blood vessels. That's not our mission statement. It was the quickest path to market. But we can now move our devices into operating rooms and allow the key opinion leaders across the world to begin realizing the value of fusing tissue with our technology and treating pelvic organ prolapse. And we're out here right now, we're in New York today, raising money for the next phase, which is moving on to the randomized controlled trials necessary for our new indication, which is fusion to treat pelvic organ prolapse.
Now, you mentioned women's health. Are there other applications? Could this be used for, a gash on your arm or some other injury?
This is perhaps the biggest platform technology medicine has ever seen. As we sit here, in every operating room, in every surgery center, in every hospital, someone is suturing or stapling in some type of surgical procedure. Every one of those procedures, general surgery, urology, gynecology, neurology, every one of those procedures is a procedure for us. So whether it's a hysterectomy, whether it's a sterilization procedure, whether it's a bowel surgery, it is a massive multi-billion-dollar space.
Does it eliminate scarring as well?
We believe that the skin closure permutation embodiment of our technology will decrease scarring, but more importantly, allow you to go back to activity right away without worrying about pulling sutures or staples out.
Okay. Is there anything else you'd like to add?
just what is almost obvious is that this is not just some great idea. This isn't vaporware. This is sitting on a shelf, 510K cleared, CE marked, paradigm shifting technology going into a very, very needed women's health space, pelvic organ prolapse. And so there's no competition in that space. There's no medical device. And we're serving a population of both women and surgeons that are in desperate need of an alternative treatment, and more importantly, are so scared of anything synthetic. And this is a natural way of improving the body's healing capabilities.
Okay, fascinating. Thank you so much, Dr. Zipper, for joining us today. The CEO of Biofuse Medical Technologies, really interesting technology, possibly revolutionary. And thank you as well for joining us on SCN Corporate Connect. I'm Jane King at the NASDAQ Market Site. Have a great day.